Welcome, everyone. Thank you for joining today's webinar. My name is Rebecca Cherry, and I'm part of the marketing team here at Laerdal. Just a little housekeeping before we get started. If you have any questions during the session, please share them via the Q&A feature that can be found at the bottom of your screen. I'll be monitoring them during the webinar, and we will have time for questions at the end. To ensure you're able to see all speakers, select the gallery view. Recordings will be emailed to you after the session is over to watch on demand. Now, I would like to introduce the moderator, our West Coast Education Services Specialist and host, Kelly McKeever.
Hi, folks. Kelly McKeever here, and just wanted to wish you a good morning, a good afternoon, good evening, and wherever you may be in the world, in the country. And on behalf of myself and my colleagues, just thank you for joining our activity today. We're glad you're here. We're glad you're able to discuss getting your simulation labs back open. And we would certainly like to welcome you to today's conversation. On a side note, just to let you know, we at Laerdal would like to take a moment really to thank you all for the job that you do, the work that you do. Just know we see you. We have a contingent that is in the field on a constant basis. A lot of the discussion today is going to be based on some of the observations that our colleagues have had out into the field with you. So we see you. And the world sees your efforts as well. And just keep in mind with as this goes on, that what we do today with our learners and our students in our own systems and in our own curricula will echo tomorrow in the new normal, whatever that will be. So again, welcome. And just briefly, again, my name is Kelly McKeever, and as Rebecca said, I'm one of the West Coast services specialists for Laerdal. But again, I've really, since COVID has kind of gotten a foothold in the United States, have been relegated to virtual education. So my new title is this little beefy sentence that you're seeing on the slide here right now. So I am considered to be a virtual education and content development specialist for Laerdal. I'm actually in Dillon, Montana, Southwest Montana. That is me in the upper left-hand corner practicing my Montana version of social distancing. If I don't want to see any other fishermen in my picture if I possibly can, but this is the way that we choose to kind of socially distance where we are here. So again, just an FYI that I've been with Laerdal for about 14 years and have the requisite healthcare background really to step into an educational role for Laerdal. So again, just kind of moving on here, just a word or two about the timing of this presentation. Now, one of my colleagues, who's the primary author of the content, is actually on the call with us as well, and we've started this hunt for this information quite a long time ago. This has been months in the development, and really truly when we decided to splash this information out into the public, we did have some opportunities to, we were seeing the cases actually drop. We really felt that the world would be opening back up in a short period of time, and we just haven't seen that. Obviously, I think everybody's aware of. And I collected all of this data on Sunday, the actual upswing in our cases and deaths and things of that nature with respect to the COVID-19. But with that, Anthony Fauci has basically indicated to us that there is light at the end of the tunnel. We're cautiously optimistic that the vaccine is obviously on its way. And as of writing with this, last night I actually went out and did a little bit of searching here in Montana. We've actually got some vaccine to our frontline healthcare workers, in addition to some of our at-risk populations as well. So, really, truly keep the faith, because there is light at the end of the tunnel, that things are turning, but really, truly, at some point, we know that our schools, our simulation labs will reopen. It may not be tomorrow in your region, and I don't think it's going to happen that way out west, because we're simply under just an upsurge in the virus at the moment in terms of cases and deaths and such. But it's going to happen. It's going to eventually happen. So with that, we do have a poll, and Rebecca's going to facilitate the information here, if she would. Okay, so we've got the poll in front of us. So when do we anticipate your sim lab to open? And a lot of people are, that's a pretty good number here. 56% of us are actually currently operational. There's a few that by the end of the year, maybe spring of 2021, that's about 27%. And then again, 14% are unsure. So that's a little bit more optimistic than I kind of figured we would be at the moment. So really, congratulations, folks. If this is indeed where we're headed with some of this, that's a positive finding for sure. So again, just a word as far as again, like we said, it may not be tomorrow in your region, but we're here really to provide you with the best and the latest information that we found to help us all get sim labs back on our feet, and all while remaining safe as best we possibly can. So so how can we get you, or how can we help you with the new normal? Again, as you take a look at this slide, I'm not sure that any of us know what the new normal is going to be. So I kind of figured maybe some of our corporate partners had kind of an idea what it would be like. And here's what I found when I did a quick search. But we just know things aren't going to look the same as they did before COVID. So with regard to opening our sim labs, there's a lot of information out there. And the information that we're going to share with you is more on the general side and gathered from various entities, government entities, observations from our field teams. And as far as Laerdal was concerned, again, we were a company that was affected by COVID, just like everybody else, from the standpoint that we saw the need to offer more virtual types of training because, again, we all had the shelter in place rules. But we did keep a contingent that is out there, and my colleague is one of them, again, that's on the call here. And we've kept a contingent in the field. So there were a lot of places, and as you did see with the poll, with 56% of the folks reporting out there, that they are operational, they're open. And because of that, we've just kind of gathered some observations from our field personnel as they continue to provide on-site services and such. So that's going to be a part of this delivery as well. And again, because we know that you're on the front lines with this, we know that you've done your due diligence as well, and really truly you have been the resource in helping us kind of gather some of this data. And in terms of considering to reopen your simulation lab, we know that you've done the track work. And because of that, if you have information to share that you wouldn't mind getting out with the rest of the world, we'd certainly entertain anything you have in terms of the current body of collective wisdom. So we'd love to share that with other folks. So just know that our ear is there, and that we are more than willing to pass this on, really to kind of help us all collectively move on as well. So again, where would we be without at least a few objectives today? And really by the end of the discussion today, we're hopeful that you'll be able to do a couple of things with this. So number one, I know that this is probably baseline foundational information, but for those who have not had the chance to do some of the legwork, we're going to give you the opportunity to identify COVID-19 screening techniques before you admit your learners into your skills and simulation labs. We want to help at least provide some information to create a list of personal protective / body substance isolation equipment that be required for learners to enter your specific facility. And really, depending on where you are and what you do, you'll most likely have to create protocols, policies, procedures that are particular to current health requirements and suggestions that, again, that have been provided by the government and such to make sure that we're doing everything safely. And again, particular to social distancing, lab capacity, cleaning procedures. You'll additionally probably have to identify resources to base your policies upon. And again, this is what we're collecting on a daily basis, and make sure that we do provide these resources for you by the end of the discussion today. So we'll have lots and lots of links, lots and lots of resources for all of you to tap into and complete whatever task it is that you need to do. So again, with respect to more of these objectives here, how are we going to organize our lab layouts and process flow really to meet the educational needs of our learners? And again, while keeping them healthy. And lastly, identify some COVID-19 resources at both the national and state levels. And Karen, my colleague, is a Texan, and so she's got some wonderful Texas state resources. I myself, again, with Montana, I've provided the links for our Department of Health and Human Services for you as well. But again, wherever you happen to be, it's not a difficult search really to encounter or to produce. If you simply get on the World Wide Web, type in your state name, COVID-19 resources, you will find a plethora of information that is out there particular to your facilities and particular to your state and such. So with that, again, these are not hard resources to come by. And one more statement here in terms of some of the things that we would like you to do here. We need your input. The world needs your input as well. So please ask questions. Provide us with your experiences. Again, place them in the Q&A or the chat function, and so that we can collate all this information. And like I said, so that we can kind of, again, get this out to the rest of the world, so that, we can share the best practices necessary to move our systems on and whatnot. And again, both myself and Karen will address some of these questions as they apply towards the end of the presentation today. Okay, so getting right on into the meat of this in terms of some of the screening elements. And again, I'm sure that folks have seen this as well, but again, we've basically reeled in our information from the CDC. What are they asking, or what are they asking us to ask folks before we allow them into our simulation labs to work. Again, this is I have a doctor's appointment the other day, or had a doctor's appointment the other day. These were the screening elements that people asked by and large, even though they're asking a few other questions. So most of us have experienced this as well. And but again, there are some signs and symptoms of COVID-19 providing the basis to these questions that we'd ask any learner or participant prior to allowing them entrance into the sim lab. So, and as my colleagues have found out, the answers to these questions can be obtained many different ways, folks. Karen was telling me a story the other day about a door monitor who was sitting on one side of the door. There's a camera system coming out the other side of it. The students step in underneath the camera, complete a questionnaire, and then they actually have to show the camera or slide it under the door, whatever the case may be, so that once we have that sheet and we have the information from the sheet, we can obviously just either allow them in based on the answers to these questions here that you're seeing, or again deny them because there's some positivity with this. So again, this is pretty much the baseline for the information provided by the CDC. And again, we can provide these by computer, by posters, signature sheets. We can simply ask the question. Other questions that have been asked again, and I'm going to tap into Karen here just a little bit, if she wouldn't mind popping off of mute, because she had some really good experiences with this as well. And Karen, what were some of the other questions that you were asked, or that you've seen being asked by some of our colleagues in the simulation world? Okay, maybe Karen is unavailable at the moment, so I'll pop into this. Oh, there she is.
Okay, besides the typical signs and symptoms of fever, loss of smell, loss of taste, I have been asked, have you traveled outside of the United States? Have you been in contact with anyone who has been diagnosed with COVID? So people are being very careful with their screening questions, and it seems like every place I visit has a basic list, but then some of them have alternative questions too.
Okay, and because there's alternative questions out there, this is where we're asking you. Post yours in chat. If you've got some other information that you're asking learners, if you're asking people prior to allowing them into whatever space that you do have, post them in chat. We'll collate them. We'll get them back out to the world as well with this. So, the other part, just via conversations with Karen, additional screening should always be obtained if we can. They don't let me in without a scan of my forehead, and I've got a lot of forehead scan here these days. But just getting the temperature, obviously, from whomever it is before you allow them into your system. So once again, post your stuff in chat. But I just kind of liberated this one from the CDC, and this again is what it looks like out there. I did pop in the URL down here at the lower right hand, and we'll have that available to you at the end of the presentation as well. But here's pretty much what the CDC is saying. Again, you've got all sorts of links and resource links to this, but this is pretty much it. This is what the document looks like at this point in time. So past that point, once we've got this down in terms of the screening, are we ready for action? Are we ready basically to allow people into our simulation environments and such? Because really, how do we know? How do we know that we're ready to go? So really, the emergence of COVID-19 caused us to become really creative when it kind of came to personal protective equipment, It was, we saw there was obviously an increased need, a shortage of our personal protective equipment, body substance isolation. Moving forward, for obviously safety's sake, we need to be proactive, obviously prepared and properly protected here. So this is one of Karen's favorite movies here, as far as the that you see on the slide here. And this is in the movie called The Little Giants. The kids who wanted to play on the team, on the football team, had to scrounge for whatever equipment they could find in order to play. And really, truly, we kind of saw something similar when COVID emerged, that healthcare educators, education in general, had a similar experience. We had to find body substance isolation, personal protective equipment, wherever we could, whenever we could, and we hoarded it. And because of the shortage, this was, obviously a major reason for the end of many clinical rotations for our students. There's just not enough nor the proper type of personal protective equipment available. But now it's a little bit more available than it was, although it's extremely expensive and more than, or obviously than it was, 8 months ago. But now, if our students become eligible for clinical rotations again, we're going to have to make sure that our programs are proactive, prepared, and ensure that our students are properly protected with this. So, Karen, any other additions on this at all? This part?
I don't think so.
Okay, and so what we've got here is essentially just kind of a list that we've seen, obviously, and again, that we've gleaned from the CDC and just our observations in general. But here's another poll here that Rebecca's going to facilitate. And as we run through this poll, what is the personal protective equipment currently required in your simulation lab? What do you do? And if something's not up there, please click on the bottom one and give us a few of your comments in chat. So we know that different facilities, different entities require different personal protective equipment, body substance isolation. We know that eyeglasses are just not considered to be PPE or BSI, but we do know that gloves, specifically eyewear, the goggles in nature, face shields, things of that nature are. And again, you may ask your students to provide some of your own personal protective equipment, or their own, pardon me, or a portion of gloves and masks. But again, are you going to allow them to reuse certain personal protective equipment, body substance isolation, such as masks and whatnot? And if you do allow them to do it, what is your plan in order to get them there? Are they going to be able to steam them in a microwave? Are they washing them every day? How are you going to be assured that they are clean? What's your plan for cleaning these? Logistics, movement, so on and so forth. And again, the poll is in as far as the information is concerned. And let's see. So gloves are required basically in about 3% of the labs here. Nobody said anything about a face shield. Masks are 37%. Glasses, no. All the above, that's where the majority of our answers are. So good deal in terms of that, Karen. And we got that at about 47% as well. So again, other considerations with respect to this are really, again, that we do have a plan, that we're proactive, and that we do have availability and such for this stuff, or at least a plan for learners to bring in their own things as well. So moving on, as far as past personal protective equipment, things of that nature, what do logistics and process flow look like in your lab? What are the things that help us keep socially distant, yet help us still get our simulation objectives accomplished here? So once we've established proper personal protective equipment, we need to consider the lab logistics and such. So this is obviously a function of the size of our lab, the number of, equated with the number of learners that we have. Some of the questions that are out there: how far should we place the beds apart? And again, keeping with social distancing imperatives, this should give you kind of some of your answers that you're looking for there. How many learners can we safely accommodate? So, and again, according to the Society for Simulation in Healthcare, really, we're just going to kind of give you the options to take a look at this slide from a 20 by 20 foot lab is what they feel can accommodate up to 8 to 10 people in the lab as well. So really, truly, the way that we can actually run this is that, we can, if it's 8 to 10 learners at a time, 2 learners per bed, and then again, keep one practitioner on one side of the bed and one on the other. For smaller spaces, we may have to consider using every other bed in the environment. If you can kind of see this slide on this side. So, we might have 12 learners that we need to move through this smaller space here. In order to do that, think about cutting them into two groups of 6. Group 1 is going to use bed A, C, and E, whereas group 2, when they come through, will use B, D, and F. Okay, and so that's going to give us the possibility of running this group through and maybe half a day to get them there. And once the full rotation of the students have come through, then we're going to have to be able to clean that environment and make sure that we can do it maybe for an afternoon group if we so desire. But at least we've considered logistics, we've considered time of the simulation itself, how long those learners will be in the lab and such, so as to really give us an opportunity to make sure that we clean the environment within confines of the rules and such. So as far as, again, cleaning is concerned, the specific devices as far as the Sani wipes, the Cavi wipes, so on and so forth. And as far as like other elements, and we'll get into cleaning elements a little bit later on in the discussion here as well. But again, this kind of leaves the noon hour, lunch hour, or potentially having our learners help clean the workstations as well, which is not a bad lesson in general as it is. But Karen, any further observations? Because I know that this was one of the examples that we talked about, but I think you've been really privy to more of these circumstances where people have had to kind of creatively outline the process flow and actually crowd control of their learners.
So I think the biggest challenge is trying to get everyone through the lab and try to maintain social distancing. Kelly mentioned having learners on each side of the bed and also having markers on the floor at the end of the bed so that the social distancing is kept intact. And then the rotation of the beds, cleaning the labs. Again, I think it's great what he said about students being able to wipe down the beds. And I believe that will seg into the next slide when we talk about linen and equipment.
Sure. And in terms of some of that information, again, as far as linens are concerned, we'll get into that in just a little bit. But these are some of the things that we've collected in terms of some resources. And you can see that this is a lot of this is from the University of Maryland and Baltimore, but just some of the things that people are posting up and around their environments so folks can see. And again, you can kind of see my footprints in the sand here in the background. And again, this is just to kind of emphasize what Karen was talking about in terms of just demarking our environments so that people know where to walk, how to maintain, where to walk, I guess I should say. Let me clarify that, but just kind of keeping the process flow in terms of staying on the right side of the lane. And so it just helps us maintain the social distancing. So again, logistics in terms of crowd control and personnel flow through the simulation lab, and really just with regard to access to the space itself. Now, how do we make sure that we have the logistics of entrances and exits in our building with respect to social distancing? How do we keep those two elements kind of in check? So we want to keep folks from kind of using the same pathways for both entry and exit. We want to kind of make sure that one goes one way, one goes the other. And because of that, we want to consider those routes and how do we mark them and such. So consider use of directional stickers, and that's what I'm kind of showing with my feet here. And I got a couple of other examples here on the way because there's different mechanisms to move people around, such as stairways, such as elevators and such. But we want to figure out, again, how do we sign or provide the instructions for people to actually use these elements safely and such. So hand sanitizer, one of the creative places that we've seen this is posting them on convenient locations around entrance and exits and things of that nature. Pretty common sense, but creative nonetheless here. So consider additional signage as needed. And like I said, with directions for flow and such, and as we have said, just kind of creating social distancing techniques by keeping people on opposite sides of the bed and such. But here's a couple of the examples that we've seen that are out there, and I know that you folks have seen this or probably use something like this as well. So please, again, send us your stuff, send us your resources so that we can actually post those out there as well. But now elevator distancing, and again, with respect to stepping into an elevator and keeping yourself distant with folks, and I guess, again, face the wall and try to keep yourself as healthy as possible. Again, this looks like a kind of a traffic lane here on the right-hand side, but it keeps you on one side of the hallway going down the other to make sure that we maintain a little distance between ourselves as well. A couple examples that we've seen in terms of stairwells, well. Show you really the differences between some of the pathway flows on the stairways, social distancing mechanisms there on the right, so on and so forth. So a couple of different examples that are out there and for your consumption here. So other infection control protocols that need to be considered, again, with respect to your simulation labs, as far as, again, limiting the size of groups, and we know that. Because, again, too many people are going to bump into each other. It's going to threaten our social distancing imperatives. Cleaning common surfaces and whatnot. That, again, like any place where people are going to sit, and tables, chairs, doors, doorknobs, all need to be cleaned on a regular basis as well. And Karen had a little experience with an entity here not too long ago, where she had noticed that a lot of the parts of the environment had been basically roped off. Karen, you want to expand upon that, please?
And that was basically commons areas where there was seating for students. Basically, those had been marked as a no seating zone, and that's just to keep people from sitting there and then moving and more people coming in without it being cleaned in between. And also the water faucets have been covered up where they're not available too.
Mm-hmm. And again, and just with respect to the common surfaces as well, it's not just universities and hospitals and whatnot that you see this, and you see this all over the place. But again, I think we can take some information away with what it is that we're seeing here as well. But again, probably some of the nitty gritty that people would like to know and get into is really the cleaning of the mannequins and the simulation equipment, which needs to be obviously done regularly. And we'll kind of dovetail into that a little bit later as well. But just to foreshadow the absolute piece of information that we really hang our hat on, is really hanging with manufacturers, their directions on how to keep things clean and sterile and so on and so forth. And again, from the Laerdal perspective, we'll provide you with lots of information as far as where to get that information from us. That's directly from our resources. So, and again, Karen had mentioned, as did several others of our colleagues, about how many people or how many places are just removing those common items. Pen holders, notepads, anything that's that can kind of be grabbed and touched by multiple people. Again, just kind of removing those from the environment so that we kind of just again inhibit kind of the spread of this stuff. Guidelines for learners in the sim lab. So specifically with them. In the sim lab themselves, obviously adhering to the mask guidelines. We know the importance of the mask. Ensure that you've been screened. Again, if I step into the sim lab and I haven't had the chance to screen to go in, I should stop. I should not go in until I've actually been screened. So again, maintain the social distancing imperatives. The congregations in the common areas, as Karen had said. And then again, keeping your hands clean, frequent washing of the hands with hand sanitizer and such, uber important to mitigating the circumstances here. So maybe a few ancillary considerations for logistics and process flow with folks. Now, remember, this is just to organize and control your process or control crowds and things of that nature. So most open simulation labs have considered an increase in their hours of operation to accommodate students. I do know and am very aware of the downside of that in terms of personnel, staff matrices, overtime, things of that nature. But again, these are just considerations, things for you to look at as you look to reopen. So some folks are, again, as far as like assignments for lab time, organizing that matrix, and I've seen a lot of places do this even outside of COVID as well. But just organization from FISDAP/email, calendars, things of that nature, to make sure people are structured and scheduled for the lab session and such. Taking control of other time slot assignments again, designating waiting areas, and again, once we do this, we got to kind of be considering where we are. Waiting areas look a lot different down in California than they do in Montana. Again, we can freeze people up here if we make them wait in the wrong areas and such. So once again, our scheduling imperatives so that we don't overwhelm the numbers in our areas are very, very important. So again, we've talked about the need for or potential need for a door monitor. And think about one of these examples here is that if we allow our students to use their own equipment, such as a stethoscope, how do you know that that stethoscope is sterile when they step through the environment? And the example that was given to me is, maybe nursing student A goes home and listens to so-and-so's lung sounds, and again makes contact with somebody that perhaps had the virus, and we don't know. How do they know when they bring that back to the facility that it's clean? How do you verify that? What's your process to associate that with your students as well? So, door monitors, somebody that's responsible for that documentation, that screening, is obviously a potential need. So, again, to help accommodate this, to help the logistics, the process flow, understanding, the length of the assigned labs and such. When we teach our sim designer courses, creating themes, creating scenario files and things of that nature, we've always kind of put up at the top of the document, what is the intended duration of this simulation? And really it does have to do, obviously, with debriefing, with typical education, but it has an application here as well. Obviously in terms of the logistics, kind of think back to the slide where we had the people walking through the 20 by 20 lab. Again, as long as we kind of know how long these things are supposed to last and we adhere to those goals, then we're able to pretty much predict the open time for cleaning the environment as well. So again, does the time of your simulation, or the time in between simulation, allow you for proper cleaning of the mannequin, your environment, so on and so forth? And again, when we're talking about cleaning, we'll give you some of the manufacturer recommendations specifically from the Laerdal perspective. Other things to consider here is basically debriefing rooms. Again, with the same consideration that you have in your sim labs. How wide or how big are they? Do they facilitate social distancing and things of that nature? And this all needs to be looked at again as you step through potentially to open your sim lab. Now, Karen again had an experience here that I want to kind of leave in her hands, but we all in simulation labs go through a ton of linen and whatnot. I mean, it's just one of those things. It's kind of a constant thing that we all have to kind of take consideration in. And Karen had an experience here again with a customer that was out there, and I'll leave that one to you as well, Karen, if I could.
Okay. So some options that have come up are that some schools are just not using linen at all. And it's simply because of the cost of changing it between every set of students and having it laundered and restocked. Some people are using just like a tarp on the bed and being able to wipe it down. I think at this point in time, you have to consider your human resources and your financial resources when it comes to the use of linen and what it's going to take to strip the beds, remake them, have the laundry done. So it's going to be individual for every facility, and that'll just need to be part of your policy process.
Now, I think in the same regard here, Karen, you had some observations as far as some of the water fountains and things of that nature. And again, I know that this is not going to be new news to other people that are out there, but some it may be. So we've always kind of had a conversation based on encouraging students to bring their own water bottles and things of that nature. But if you wouldn't mind expanding on that as well, I thought that was an interesting experience that you had with this as well.
So at airports, at schools, some of the water fountains are totally closed down and not accessible, which means students have to bring their own drinks with them. And that's something else that you have to consider. Do they have to store them in their car? Can they bring them in the building? Do they need to leave them outside the sim lab? Do they have a cubby or a locker they can put them in? What if they had to park 5 blocks away and they have to go to their car to get their drink? All of this is going to be individualized based on facility and the dynamics of how your environment is set up. But it's just something to think about when you're trying to reopen and think about all the things that the students are going to need.
Okay, and again, to kind of cap that off with this, and again, it kind of dovetails well into what are your personal protective equipment BSI requirements as well. So again, if we're shutting off the water, people can't have access to it as well. what are we going to do about those kinds of things? So just one idea right there and one experience from Karen. So thank you with that as well.
And
All right.
Kelly,
Yes, please.
Kelly, let me also mention that if you are in a building that doesn't have vending machines, that may be something that you look into, is having vending machines that have bottled water and snacks for your students.
A very good idea. So again, some places do, some places don't. If you don't, you might want to consider vending machines, something that's entirely containable, and you can obviously offer the things that you want through it as well. So that puts us into the point here as far as some of the resource guides that Karen and I have put together for you. But just once more time here is always follow the manufacturer guidelines with your mannequins and such. Now, I will open up a slide here that's going to give you the opportunity as far as the URL to our manufacturer/guidelines that we use in cleaning mannequins and such for Laerdal. But again, with CDC, some of the national and state guidelines as well. But as far as we go in terms of a company here, guidelines and resources for cleaning any of our mannequins, and I mean this involves not only like your simulators that you're going to have inside your simulation environment, but this goes to CPR mannequins, CPR masks, things that you want to do after class, so on and so forth. Our guidelines for mannequin cleaning have been basically COVID tested, so that the things that we offer you out there in terms of our processes should take care of pretty much everything in terms of the need for cleanliness and sterility in terms of the virus itself. So we want to be sure that we really follow these things as well. And so this is what we're going to give you here is our URL just directly off of our website that talks really about all of our mannequins and the procedures, not only for our simulators, but for CPR mannequins as well. There's one of these things, and we teach a lot of classes, both face-to-face and virtually at Laerdal, and it never fails that we do bring up a slide or at least some sequencing on how we want to make sure, or people's questions on cleaning the mannequins, sterilizing them, and the like. And a couple of things that we can tell you. Number one, kind of refer to your user guide with your mannequin as well. Every one of our simulators comes with a physical user guide that you can refer to. And in addition to that, if you go to our website, you can obtain those user guides as well. So the information is right in there. It's going to tell you what to use, what not to use, and again, things to stay away from in terms of just substances with your mannequin, such as like inks and whatnot. We always know that with some of the older mannequins that it tattoos the skin; it just doesn't come out of there. We tend to stay away from solvents, anything that's kind of petroleum-based substances, which is so closely related to that hydrocarbon that's going to formulate our plastic skins on our mannequins and such. And because of that, they tend to bond and burn and so on and so forth. So none of that if we can stay away from it. But a lot of the new citrus-based cleaners are out there. We do have some statements on those based on this slide as well. Lots of good information in terms of cleaning that. But just take a look, take a moment to move through that, and you'll find that it's relatively intuitive and simple. Okay, so again, just one of the things and I'm just going to echo Karen's advice here as well, that there's just no way that a manufacturer can step out there and test every new cleaning agent that's available on the market. We don't have a position on each and every one of those, simply because those things are created every day. We do have a list of acceptable items that are on this the slide that you're seeing here. But by the same token, we test constantly, but we can never keep up with the number of things that are actually out there in the world. So please consider our list and take a look at them and see what's out there for you. Okay. A couple of other things here in terms of substances themselves, and again, this comes directly from the CDC. And those of you who worked in a hospital, and I know we all have some roots there as well. But in every of the departments that we had cleaning agents or any chemical, for that matter, didn't have to be something associated with cleaning. It could be really anything, but each of them really kind of had to have a material safety and data sheet attached to it so that we knew what to do with it in case there was an exposure to the chemical. Again, we always had this information at our fingertips in the hospital as well. But if you go to the CDC, if you've got any of these substances out there that you have in your simulation environment, and again, you can kind of see over the right-hand side what that list of things happens to be. or there's quite a few of them there. This website's going to provide you with a lot of information on that chemical itself. You can cross-reference these, obviously, with the manufacturer's response to cleaning, like with Laerdal and whatnot. So you can cross-reference these things over. So this website obviously contains an overview of the substance, its mode of action of the substance itself, its effect on microbial activity, and then specific uses with it as well. So, and like I said, it's going to have everything you're going to need to know about that substance as well. So, nice guideline for you, nice resource for you to take a look in as well. Okay, these are by and large hard surface elements, chairs, things of that nature. But like I said, if you're going to use it on a mannequin, you want to go take a look and see if that's actually on the list of our approved substances as well. If it's not, stay away from it or give us a call. Okay. A couple of the other things that we wanted to provide you for before we end up doing some Q&A with you is, again, just kind of give you a couple of ideas out there in terms of some of the resources. And I'll take this kind of, again, from the Montana's perspective, but I'm going to have Karen weigh in here again on some of the other ones. Obviously, she's got some things here in terms of state information from Texas. I've got mine as far as Montana. But Karen also has a real presence with the Society for Simulation in Healthcare. And I wanted to speak about that firsthand, if she wouldn't mind as well. But before, again, I turn the mic over to her. Again, the CDC is always going to have information on it. You just type in CDC and COVID-19, you're going to get a plethora of information that's out there, and it's up to date and recent. So, Karen, if you wouldn't mind talking a little bit about the SSIH and the Texas perspective.
Certainly. So if you go to ssh.org, there are several threads there that you can look at, and they discuss everything from how to clean hard surfaces to how to reopen your lab to what you're expecting your students to wear when they go back to lab, and how they're doing virtual simulations because they can't get in their sim lab. So SSH is a great resource for you. Go to ssh.org, check the discussion threads, and you can really connect with frontline users who can offer you valid information and help and assistance and answers to your questions.
And this also, you should probably comment here as well, some sample policies and procedures.
Yes, there are sample policies and procedures that I've found on ssh.org. I've also just Googled SimLab policies and procedures and /COVID and procedures due to the COVID situation. You can find stuff online, and we found some that we've saved, and we'll be happy to share them with you if you are interested.
And then finally, really from the Laerdal perspective, we do have some other things that we're out there and we're constantly working on based on your feedback as well in terms of virtual resources. And again, here's just kind of a partial list of that. But many people have asked us again, how do I best support my learners until we open? Again, this is because we're faced with actually reaching remote learners as well. So of course, with our LEAP software that we do have, that's kind of the cornerstone of a lot of our simulation products. We do have courses that show you kind of how to leverage that LEAP software to reach distant learners, remote learners as well. So this first one here is just actually called Telesim, and essentially what it is behind this is just facilitating live simulations with your remote learners and trying to keep them engaged and involved with hemodynamics and patient presentations, decision making, and critical thinking as best we possibly can with them. And we do have a whole host of other things that we can help you with as well. First one here is kind of what we call an orientation to. Of course, really it's an orientation to whatever mannequin, whatever simulator you do have. We'll facilitate a head to toe, a startup, a shutdown, kind of a navigation or quasi quick navigation through whatever device, be it a SimPad or a LEAP application that you run your mannequin with. Simulation as a modality, again, more kind of a curricular type of a discussion. If in fact that's you find some changes in your curriculum, again, how do we kind of bend that over to remote learners? Because again, most of us are pretty well set up to deal with the face-to-face learners and such, but we do need to again, face realities in terms of what it is that our learners need. And again, creating your own themes, creating your own scenario files through Sim Designer. We're more than happy to help you with circumstances should you find those things to be particular scenarios, particular theme files that need to be created for your learners in your curriculum. We're standing by to help with that as well. And again, as always, there's navigational type of courses. So we're going to show you around the platforms that we do have that operate and control those mannequins. So we'll help you with simulation mentoring, simulation strategies, things that we can help you get everything set up to basically run in whatever type of a circumstance you have, be it a virtual circumstance or a live face-to-face type of a circumstance as well. And there's more to come. And again, the menu grows as you give us the information that you require as well. So with that, I'm going to open this up for some question and answer. But I'm also going to, Karen, if there's anything you'd like to say before we get to the Q&A and just kind of conclude the discussion.
Well, I'm glad everyone joined us today. We really appreciate how all of you share with us your best practices so that we can share those with other people. And we're looking forward to hearing your questions and your ideas and your comments so that we can all get better at what we do.
Absolutely. Thank you. Okay, Rebecca, anything from your perspective? Would you like me to sift through some of the Q&A in the chat, or how do you want to proceed from here?
Yeah, I was looking at the Q&A, and I'll encourage anybody, if you have any questions, you can go over there and start putting your questions there and we'll look for them. And then there's been great discussion happening over in the chat. I noticed that there's some interest in policy and procedure resources, so that will be great. We could help them out there. And then I saw a question saying, how do we get information on Telesim?
That one as well. You can just contact me. You can contact any representative from Laerdal. It's out there on our website as well. But I'll make sure that my email is there in case you want to contact me directly. Again, it's really kind of been my job virtually to kind of to do a lot of these, create the curricula and that type of thing. So I'd be more than happy to talk to you directly to give you more information on Telesim. So I want you to know everything there is to know about it in order to help you make the best decisions that you can make for your circumstance. And maybe for you, some of it may not. It just, it's one of those things I'll let you know. So we'll make sure that we post a phone number. Really, email is the best way to get a hold of me. Really, with the email, then I can establish a phone call or a time to get together. So we'll definitely make sure you have that information.
And contacting Kelly would also be great for the policies and procedures because he's got copies of those that we found on the web and he can share them with you.
Yeah.
Another question is, has any of Laerdal's cleaning guidelines changed in the light of the pandemic?
Now, as far as like any of the rules are concerned, nobody predicted this when it popped out, but we've always had these elements as far as manufacturers cleaning requirements and such are concerned. So when COVID did hit, we did review the policies, we did review the procedures, and that's why we continued to put the information out on the web, is because it was proven to be COVID ready. So again, we didn't know, getting right on into the time when COVID got a foothold, but we did obviously go back and revisit the techniques, the chemicals, everything, and we found out that we're okay.
So alcohol is still a great, 70% alcohol is still a great cleaner to wipe the mannequins down with. And I think the reason I like it is because you can just wipe the hard surfaces down with it too. It's kind of a general cleaner for everything.
Yeah, and somebody was asking if the cleaning wipes that have the chlorine, the bleach, if that's safe for mannequins.
The chlorine like wipes?
Yeah, it says chlorine and bleach.
Okay, did you have a position on that, Karen?
I don't. I would actually call tech support and ask them because I don't know the answer to that question. And I would hesitate to use anything that was bleach based in case it broke down our plastic. So I would have to check with tech support on that.
And it's always a safe bet to do so. You know, I'm going to tell you that the by and large very weak bleach solutions and whatnot have always been okay around simulation labs and things of that nature, but you got to control whatever that percentage happens to be. And so with those bleach wipes and whatnot, Karen's advice is just crystal from the respect that as long as we know what it is, then we can give you an answer in terms of whatever the percentage of strength it happens to be. Obviously, we don't want a 90% solution that's going to be splashed on our mannequins. You know, that'll eat most things. But yeah, just give them a holler. And you know, again, have the information from the actual wipe itself handy, and they'll be able to tell you straight away.
Great. Someone's asking, I think this one's around what platform you would maybe recommend. How do you do a simulation distancing? Do you use Zoom or what platform? We're going through Zoom right now, but maybe you can say, you know, when you're doing other meetings with your customers, how do you do your simulations or product demonstrations?
That's a real good question. You know, we found a couple of things. Now, Zoom being our chosen platform doesn't mean that that's the end all say all on the web conferencing software that is out there to use. You know, military, for example, we get a lot of folks that can't use Zoom, so they have to use the Teams application. There is Cisco, there is a GoTo. We don't cater to any of the platforms at all, but we do find out which ones you use, and we can kind of help you with the video conferencing application and how it's going to apply to just actually send data. You know, distilled down to its most foundational aspects. You have a Leap laptop sitting right in front of you. What we need to do is have that Leap interface in front of us, and we broadcast the patient monitor software to whomever the learner happens to be, and then we show a lot of media files in behind that patient monitor as well. So you can get any kind of hemodynamic information, pictures of the patient, sounds. You know, we can download any kind of a sound that we need in terms of lung sounds, heart tones, things of that nature. Again, even if you wanted to interface these back into a lab circumstance, you can show a live picture of your lab just by use of a webcam. That's what I'm kind of doing here, and what you folks are doing at home as well. And I can always have a second one stacked in here to show other equipment if I so desire. So it's really just kind of a problem of leveraging the software that you do have. So no, it's not important to us that you use Zoom. You can use whatever platform that you're using, and we'll just help you modify or adapt your presentation to give your learners what it is that you want to give them. So again, Telesim is all about Leap and broadcasting hemodynamic plus media files to your learners to get them to assess, recognize, and obviously treat. Karen, anything from your perspective there?
Yes, I was on SSIH thread yesterday reading about different platforms that people were using. And I know we're used to using Zoom and Teams, but they mentioned several that I had not even heard of. And some of them were through their LMS, their learning management system.
Yeah.
I think the thing you need the most is the system that your IT will support and help you with.
Yeah, absolutely. And again, we can help you. We can help you create the scenario. We can help you create whatever the file it is that you want in order to like push that to your learners.
Ready for the next question?
Sure.
Okay, how many students do you allow in the sim patient room at once, and do you time scenarios so students are together under a certain amount of time?
You're gonna have to say that one more time, Park.
So they're asking how many students you would allow in a sim patient room at once. I guess that would all depend on the size of the room, right? And then if you do time scenarios, so the students are together, so maybe a certain period of time they're only allowed to be in that room for an hour together. I'm just assuming maybe what this question means.
I think this is probably better served with Karen, and I think I can kind of follow in behind it with a different perspective. But this is one that Karen has looked at.
So if you have an individual simulation rooms are typically 10 by 10 or larger. And so an individual room, two students could be in there, maybe with an instructor standing at the door or watching through a window if you have a control room. I really think it just depends on if you need 6 feet of space around you, you just need to figure out how many people you can get in a room where they can stay 6 feet apart. Sometimes that's hard to do if they're both caring for the patient at the same time, but with their PPE on, they should be okay. As far as timing goes, A lot of research will say that 20 minutes is kind of the standard time for a scenario, but a lot of that depends on your objectives. And the second layer of that, besides how many objectives do you have to ask, how many students do I have? How many rooms and facilitators do I have? And how many students do I need to get through this simulation? So if I can run 3 at a time with 3 facilitators and 6 students, then maybe I need to limit my simulations to 15 minutes and clean for, to take up 15. So it all depends on logistics, number of students, and objectives.
And really, just to kind of come in behind that from a curricular standpoint, most of the simulations that we'll actually design for customers that are out there, and what we've been asked to do with this as well, not only just think about the logistics as far as what Karen had said, as far as how long the students are going to spend time in the simulation in the lab with respect to how much time that leaves us to clean it, but think from the clinical perspective as well on this one. Most of us have an idea that the learner should be able to get through that objective set in a specific period of time. So that being said, like Karen had provided, 20 minutes is supposedly kind of the gold standard according to the SSH and such. But again, we're going to kind of come back to you on this one that, it's whatever your objective set happens to be, and from the overriding goal that typically medical simulations revolve around the effect of, or the ability of the learner to assess the circumstance, to recognize what's going on, then derive a treatment protocol based on practice acts and things of that nature. This is entirely up to you. You bought the thing, you drive it the way that you want. But I always want to know what, if I'm going to run this for somebody else, if I'm going to run a simulation for someone else that's out there, I want to know, they should be able to get their job done in how much time. If they can't get their job done in an hour, then we, that's a potential medical error, a potential element that we're going to debrief to, because we may have a performance gap. We just may not know what to do. Again, we really try to get people to put a time frame on it, not only for the practice, but now, again, with respect to the logistics that Karen brought up, I think it's an important factor as well. So again, you got to be that decider. I can't tell you, I don't think Karen can. Again, there's entities out there that have some guidelines on this, but you're eventually going to have to make that decision for yourselves.
Kelly, one consideration is to, if you have tasks in your simulation, such as starting an IV or putting down a nasogastric tube or inserting a Foley, you may already have those tasks done so that the students can focus on assessing the drainage from the NG tube and making sure that the suction is on correctly, instead of actually doing the task. Tasks typically add about 10 to 15 minutes per task to a scenario. So that may be something, if you want your students to focus more on assessment and intervention, have a few of those tasks already set on the mannequin, and then your learners can give a med or draw blood or something of that nature. It'll just save some time if you're having to get more people.
Have the patient monitor already running. Again, if you're going to wait for them to actually attach ECGs, things of that nature, understandable. Again, but you're trying to make the best circumstance you possibly can. But having all the hemodynamics up and running when they get in there again, it's a little bit of a time saver, and you're moving them to that assessment and more, critical thinking element about, this is what I see. What do I think is the evaluation of the patient? What am I going to do with this? So, again, lots of little shortcuts you can make. Rebecca?
So we're right at the top of the hour. So if we want, we can close. A lot of people are asking for your email address.
Sure.
I can put it in the chat, and then I'm not sure within the presentation if it's here, but if you're comfortable with that.
Yeah, please post that. Yeah, absolutely.
Okay. I'll do that. And then it's 3 o'clock, so I think we should probably respect everyone's time and close out.
Okay. Well, once again, thank you for joining this. And again, can't understate enough the importance of the jobs that you all have and that you're doing. And again, where this is all headed. We're going to get there. We're going to get there together. But by the same token, we got to be ready with all the creature things that we discussed today in order to make this a successful endeavor. So, Karen, anything from your perspective before we sign off?
Just thank you. We appreciate you guys.
All right. Thanks much, and have a great Wednesday.